Welcome to Module 6 of the GTFCC online course on cholera surveillance for health authorities. In this module, we will show you how to access supplementary material. After completing this module, you will know where to find supporting material on cholera surveillance. Let's start with the GTFCC app. The GTFCC app is a phone-based application designed for health professionals. It is free of charge and compatible with Android and iOS. Once downloaded, this app can be used offline. It includes summary guidance and practical tools on all cholera control and prevention pillars, including surveillance and testing. This app can be found by searching GTFCC Cholera in your usual app store via the link below, or by scanning this QR code. Supplementary resources can also be found on the GTFCC website. We invite you to consult the resources section of the GTFCC website. You can access it at gtfcc.org/resources. In this website section, you will find detailed and up-to-date GTFCC technical guidance, including on surveillance and testing. Key resources on cholera surveillance available on the GTFCC website include a detailed technical guidance on cholera surveillance, as well as a standard method to self-assess cholera surveillance systems and strategies to help countries identify priority gaps to strengthen cholera surveillance. You can access these resources by scanning these QR codes or at tinyurl/cholera surveillance. You can also access standard cholera reporting tools. This includes a template case report form and a template line list in Excel. The case report form and the line list are for reporting standard case-based data via health facility-based surveillance. The case report form and the line list contain the same variables. The case report form is usually more convenient for use when the number of suspected cholera cases is low, while the line list is generally more convenient for use when the number of cases is higher. You will also find a template community-based form for reporting aggregate data via community-based surveillance. You can access these standard reporting tools by scanning these QR codes or at tinyurl/cholera surveillance. Key resources on testing for cholera available on the GTFCC website include step-by-step instructions for performing RDT, a referral form for testing to accompany stool samples to a laboratory for testing, guidance on how to collect specimen and prepare and package them for transportation. You can access these resources by scanning these QR codes. On the GTFCC website, you will also find some training material on sample collection and testing for cholera. You can access these trainings by scanning this QR code. To support the investigation and the response, on the GTFCC website, you will find a template case investigation form which corresponds to a standard questionnaire to investigate suspected cholera cases, an Excel tool to facilitate the detection of the deterioration of a cholera outbreak by automatizing the calculation of weekly baseline thresholds using historical data, and a field manual which provides guidance for the field investigation of a cholera outbreak and for the response to an outbreak. You can access these resources by scanning these QR codes or at tinyurl/cholera surveillance. Reporting regularly on your country cholera situation to the regional and global levels is essential, including to enhance cross-border information sharing and guide multi-country preparedness and response. On the GTFCC website, you will find recommendations on standard aggregate datasets to be reported on a weekly basis to the regional and global level, as well as an Excel tool to facilitate the reporting of these datasets. You can access these resources by scanning these QR codes or at tinyurl/cholera surveillance. Lastly, the GTFCC Network is always here to support you. For additional information on cholera surveillance or to request technical assistance, please contact the GTFCC Secretariat at GTFCC Secretariat at who.int. We have now completed the last module. Thank you for taking this course. We hope that you found it useful.